Hi, my name is Caitlin Tydings, and today I'll be talking about my poster on Desmoid Tumor Volumetric Analysis for disease response post-ablation with magnetic resonance-guided high-intensity focus ultrasound. Desmoid tumors are benign, locally aggressive, infiltrative, and irregularly shaped tumors. They can cause significant deformity and morbidity through pressure effects and destruction of nearby vital structures and organs. MR-HIFU is being investigated as a treatment for desmoid tumors, and as many of us know, it combines the technology of MRI thermography with high-intensity focus ultrasound, which uses an ultrasound transducer to focus acoustic energy, leading to focal deposition of this energy in tissue. This can have thermal and mechanical bioeffects, but in this study, we focus on the thermal effects, as MR-HIFU ablation can be used to target areas of larger tumors thought to be contributing most to morbidity. Here we have MRI images showing the effects of MR-HIFU pre and post. The first image is the pre-treatment image. This is an axial slice where the tumor is visualized on the posterior aspect of the patient. Following treatment, you see a darker area or a non-enhanced area of the tumor tissue. We refer to this as the non-perfused tumor volume. Volumetric analysis can provide precise and detailed measurements of these tumor volumes. The first is total tumor volume, which is when the tumor is segmented on every axial slice. The second is the non-perfused tumor volume, which is when T1 weighted images from pre and post contrast MRIs are subtracted from one another, allowing us to see the non-enhanced portion of the tumor, which is then segmented on every slice to provide the non-perfused tumor volume. Perfused tumor volume is found by subtracting the non-perfused from the tumor volume. This is in contrast to RECIST, or response evaluation criteria in solid tumors, which is a unidimensional measurement and currently the most widely accepted method of measuring treatment response. This is the same patient with a unidimensional measurement placed across the tumor as it would happen with RECIST. Therefore, the objective of our study is to determine whether measuring post-treatment total tumor perfused and non-perfused volumes using volumetric analysis provides clinically meaningful objective measurements of tumor response to local therapy. This was a retrospective review of MRI images of 9 patients with histologically diagnosed recurrent, refractory, and symptomatic desmoid tumors from Children's National Hospital and Cincinnati Children's Hospital Medical Center. All patients were treated with MR-HIFU on a clinical trial or compassionate use protocol. The Osiris workstation was used for volumetric analysis, and Synapse workstation digital calipers was used for RECIST. The median age was 15 years, ranging 6 to 23. 5 were female, 4 were male. The majority of lesions were in the lower extremities, and the majority of patients received more than one treatment with MR-HIFU ablation. The median pre-treatment volume and median 1-month post-treatment volumes are listed here. This is a breakdown of volumes from pre-treatment, the treatment day, as well as 1 month post-treatment for all 9 patients. We will break out one patient as an example. For patient number 1, the total tumor volume was about 136, which remained stable on treatment day 1, but was found to be increased at 1 month post-treatment. This is in contrast to the RECIST response percent change, which was actually minus 7.5 between pre-treatment and 1 month post. This minus 7.5% change does not reflect that 40% of the tumor was non-perfused on treatment day 1, and that about 25% of the tumor was non-perfused 1 month post. This is shown in the MRI images below as well. Therefore, volumetric analysis provides a more detailed measurement of treatment effect, showing us the percent perfused versus non-perfused tumor volumes, and this is not reflected by unidimensional measurements. Patterns of tumor response after MR-HIFU ablation assessed by volumetric analysis was subjectively found to be more meaningful to treating clinicians. Total tumor volume does not change as much as the perfused and non-perfused tumor volumes after ablation. Therefore, volumetric analysis better reflects the effects of HIFU ablation. Perfused and non-perfused tumor volumes are useful measurements that can be followed over time to establish how changes in total tumor volume relate to perfused tumor and non-perfused tumor volume components. Future work needs to be performed in the reproducibility of measurements and the relation to disease-free survival. I'd like to thank the multidisciplinary team that was involved in this project.